Hi, everyone, this is the Encyclopedia channel. Have you heard of split personality? This mental disorder causes a person's identity to be split into two or more distinct personality states, which can seriously affect a person's life and even threaten a person's existence. So what is a split personality? What are the symptoms of split personality? What caused it? How to treat it next, and how should we ordinary individuals prevent this kind of mental disorder? Split personality is a mental disorder also known as multiple personality disorder. It is thought to result from childhood trauma and is characterized by a person's identity splitting into two or more distinct personality states. Each personality state has its own unique way of thinking, feeling, and acting, and sometimes even a different voice, appearance, and language. These personality states often arise in different contexts and may not be related in any way to each other. In addition, these personality states may also conflict with each other, leading to confusion and incoordination in the patient's behavior. Symptoms of split personality can be divided into three categories, namely cognitive symptoms, affective symptoms, and behavioral symptoms. Cognitive symptoms. Sufferers may feel confused, not knowing exactly who they are. They may have memory problems, not being able to recall important events, or forgetting their names and birthdays. In addition, they may develop a sense of hearing inner voices, which may be those of other personality states rather than the patient's own. Affective symptoms. Patients may experience mood swings and instability. They may display different emotions such as anger, fear, depression, etc. in different personality states. Sometimes these emotions can take a sudden turn, leaving the patient feeling very confused and disturbed. Behavioral symptoms. The patient's behavior may appear chaotic and uncoordinated. They may show different behaviors in different personality states, and sometimes even make unreasonable behaviors, such as self-injury and suicide. As for the reasons for split personality, at present, the exact cause of split personality is not completely clear. However, some theories and research suggest that the following factors may be involved in the development of the disorder. Psychological trauma. Psychological trauma is considered to be one of the main triggers of split personality. These traumas may include childhood physical abuse, sexual abuse, emotional neglect, terrorist events, etc. These traumatic experiences can lead to a fragmentation of the individual's identity in response to unbearable pain and stress. Malfunction of coping mechanisms. Normally, people use healthy coping mechanisms to deal with stress and trauma in their lives. However, for those with split personality, these coping mechanisms may not be functioning properly, leading to fragmentation and separation of identities. Biological factors. Although there is no clear evidence that split personality is directly related to biological factors, some studies suggest that genetic and neurochemical factors may play a role in its pathogenesis. Genetic variations in specific genes and neurotransmitter imbalances may increase an individual's risk of developing split personality. So, how to treat split personality? Treatment for split personality is usually a comprehensive process that includes psychotherapy, medication, and supportive care. The following are common treatments. Psychotherapy. Psychotherapy is one of the most commonly used methods of treating split personality. One such effective psychotherapy is cognitive behavioral therapy, which helps patients identify and change unhealthy thinking and behavior patterns. In addition, for patients with split personality, specific psychotherapy, such as dissociative therapy and integration therapy, can help them integrate different personality states and improve self-identity and function. Medication. Medication is often used to control associated symptoms such as anxiety, depression, and insomnia. Antipsychotics and antidepressants may be prescribed to reduce symptoms and improve daily functioning. Supportive care. Supportive care also plays an important role in the treatment of split personality. This form of therapy focuses on the emotional support and stability of the patient, helping the patient cope with trauma and emotional distress by building trust and providing a safe therapeutic environment. Supportive care is usually provided by an experienced psychologist or therapist who develops a collaborative relationship with the patient to help the patient improve daily functioning and work through the difficulties and challenges the patient is facing. Education and self-management. Understanding the concept and treatment of split personality is critical for both patients and their families. Through education, patients can better understand the symptoms and challenges they experience and learn how to manage them. Self-management skills, such as emotion regulation, coping skills, and self-care, can also help patients improve their quality of life. Teamwork. Treatment for split personality often requires an interdisciplinary team working together. This team may include psychiatrists, psychotherapists, social workers, and other related professionals. Together, they develop a treatment plan, provide comprehensive support and management, and ensure that patients receive appropriate medication and psychotherapy. For example, Jessica, pseudonym, is a 30-year-old woman diagnosed with split personality. She experienced severe physical abuse and emotional neglect as a child. During the treatment, she gradually showed two different personality states. One is the introverted and taciturn Jessica, and the other is the extroverted, angry and fearful Amy. Through cognitive behavioral therapy and integrative psychotherapy, she gradually learned to integrate these two personality states and improved self-identity and functioning. Mark, pseudonym, is a 25-year-old male diagnosed with split personality. He has been through multiple instances of sexual abuse and terror. During the treatment, he displayed three different personality states, namely Mark, Peter, and Alex. Mark is an introverted, depressed personality who often feels helpless and self-blaming. Peter is an impulsive, angry personality who often displays aggressive and violent behavior, and Alex is a young and innocent personality, has been abused and hurt many times. Through dissociative psychotherapy and supportive therapy, Mark gradually learned to recognize and manage these three distinct personality states. During therapy, he learned to face past trauma and gradually regained his confidence and self-esteem. He also learned to employ healthy coping mechanisms to deal with the stress and emotional distress of everyday life. The healing process was difficult, but Mark eventually achieved inner harmony and integration and began to rebuild his life. Through these two cases, we can see that the impact of split personality on the lives of patients is huge and complex. However, with appropriate treatment and support, patients can gradually regain their self-identity, increase their level of functioning, and achieve greater control and adaptation in their daily lives. Therefore, an understanding of split personality and timely intervention are crucial to help patients rebuild their identities and achieve mental health. So, how can we ordinary individuals prevent the occurrence of mental illness such as split personality? In fact, ordinary individuals can prevent the occurrence of mental illness such as split personality by actively paying attention to and maintaining the mental health of ourselves and those around us. This includes the following aspects. First of all, education and awareness of mental health is very important, and good mental health habits must be maintained. Understand the basic concepts and importance of mental health, and recognize the close relationship between mental health and overall health. This can be done by taking mental health education classes, reading related books and articles, and following reliable mental health websites and resources. And get regular physical activity, get enough sleep, and eat a good diet. A regular lifestyle helps stabilize emotions and maintain mental health. Second, actively coping and dealing with trauma is key. Individuals should avoid violence, abuse, and other traumatic events as much as possible and maintain a safe and stable environment. If you have experienced psychological trauma, seek appropriate psychological support and treatment early, such as psychological counseling and psychotherapy. This can help individuals deal effectively with trauma and reduce the development of mental health problems. At the same time, it can include learning relaxation techniques, such as deep breathing, meditation, and yoga, to help relieve stress and anxiety. Find hobbies and activities you enjoy, such as reading, drawing, music, or playing outside, to relieve stress and promote mental relaxation. Additionally, building healthy social relationships and support networks is critical. Establish a relationship of mutual trust, support, and understanding with relatives and friends. Share your feelings and troubles, and seek support and understanding. Participating in community activities, joining interest groups or volunteering organizations, building connections and friendships with other people, and increasing social and emotional support can help reduce burden and pain. At the same time, learning effective coping skills is also an important part of preventing personality splits. Individuals can learn positive problem solving, emotion regulation skills, and coping strategies to better handle life's stress and challenges. This may include finding practical solutions to problems, seeking social support, and employing relaxation techniques such as meditation and deep breathing. Also focus on developing a positive mindset and an optimistic mindset, focusing on your accomplishments and positive aspects. When you encounter difficulties, try to find a solution to the problem and believe in your ability to meet the challenge. Finally, we as individuals should always be on our toes and seek help and support ahead of time. If you feel that your mental health or those around you are being affected or showing signs of psychological problems, don't hesitate to consult a professional mental health professional as soon as possible. Professional help can provide accurate assessment and diagnosis, along with appropriate treatment and support, to help us better cope with and manage mental health issues. It can be seen that although it is impossible to completely prevent the occurrence of the mental illness of split personality, we can effectively prevent the occurrence of the mental illness of split personality through these methods. However, it needs to be clearly pointed out that these measures do not eliminate the risk of the disease 100%, because split personality is a complex disease, the development and cause of which involve many factors. If you are concerned that you or someone close to you may have a split personality or other mental health problem, it is best to consult a professional mental health professional for evaluation and diagnosis as soon as possible. Professionals are able to provide personalized advice and treatment programs tailored to our needs and circumstances. Usually, it is also important to actively pay attention to the mental health of yourself and those around you. If you find signs of abnormal behavior, mood swings, or social withdrawal in yourself or others, you should pay attention to it in time and encourage you to seek professional help. Early intervention and treatment can help reduce symptoms and prevent further progression of the disease. In summary, although ordinary individuals cannot completely prevent the occurrence of split personality, a series of measures can be taken to reduce the risk of the disease. Through the above methods and efforts, we can personally develop mental resilience, improve mental health, and better cope with underlying mental health problems. That's all for this show. What do you think about it? Welcome to leave a message in the comment area to discuss with everyone.